I am very excited to be here with Dr. Nassir. He was not one of my doctors, but I've heard his name for several years, and I know that he's an excellent doctor. And Human, who you saw, told me that he was being treated by Dr. Nassir, so I came here to see Human, and I'm like, is he in? And they said, yeah, but he's really busy. And so I had to like devise a plan to like get him in the hallway. So I scooped him. I'm like, Dr. Nassir. So first of all, thank you very much for doing this.
My pleasure.
For inviting us in.
Thank you for being here.
And I know that you're a good doctor, but you go above and beyond, and your patients talk about it. You can read about it, and I just know it from my interaction with you. So let's start with the basic questions, which are, what is an oncologist?
An oncologist is a physician that has specialized in treating cancers. It's usually cancer treatment as well as blood treatment. So we do hematology and oncology. You first go through medical school, then you go through 3 years of training to become an internist, and after becoming an internist, you do another 3 years of subspecialty and fellowship to specialize in treating cancers. So that's an oncologist.
That's a lot of school. And then when did you decide to set up the Cancer Care Institute?
You know, I was not even going to be a cancer doctor.
Okay.
When I started medical school, I was more interested in becoming a neurosurgeon.
Oh,
so
wow.
I started doing research and worked with the right guys to get myself into a neurosurgery program. And then all of a sudden, my father was diagnosed with stage 4 prostate cancer. Okay. And he got really sick very quickly. And I basically got a quick crash course in oncology through my dad's experience.
Okay.
And within the first few months of going through what he was going through, sitting on the other side of the table than doctors and seeing what the oncologists do, I decided I should really become an oncologist.
Wow.
So one of the goals I always had as an oncologist was to be able to treat any type of a patient that I want to treat. I didn't want to be dictated in terms of what to do and what not to do and limit myself to a certain type of cancer. So to be able to do that, I had to have my own practice. I had to do it in a sort of a private, individual way that I can call in the shots. So when I finished my fellowship at Norris Cancer Center at USC,
right.
I decided I'm not going to work for anybody. I'm just going to go straight into private practice. And so since 2002, I've been an independent private oncologist. They call me a dying dinosaur because, we don't exist anymore. Everybody's becoming bigger groups. Offices are not they're not family type of offices anymore. You go see an oncologist, they're a group of 10.
Right.
If you need to call your doctor on Saturday night, you may never reach your doctor. So I'm trying to sort of keep that old-fashioned model in combination with all the high-tech stuff we do as oncologists in one roof.
So your patients have access to you at all times?
Pretty much. I haven't had too much in terms of vacations, but even when I go on vacations, my patients always have access to me directly. Majority of my patients have my personal cell phone. And it's not easy, but they understand that I work hard. They don't bother me, but if they really need me, they come to me direct. They don't have to go through a nurse practitioner or some coverage person who really doesn't know them.
That is wonderful. I know, having been a patient myself, to have access to your doctor or to your surgeon is just a weight off your mind. Like if you're worried about something or you're in pain and you can talk directly to your doctor, it's like makes a world of difference.
You know, one of the when a patient is diagnosed with cancer, obviously people think of it. The first thing is a death sentence.
I know, but we're changing that.
We're changing that. But then, other than the cancer and dying and all that stuff, is the anxiety about what's going to happen when I'm on chemo, and questions come up.
Yes.
I always tell my patients the first few times when you go through chemo, the littlest thing that's wrong or there's questions in mind, just call me. Don't be afraid. Once you go through this for a period of time, you realize that it's not as bad as it used to be.
Right.
With all the tertiary supportive cares we're doing for patients in terms of nausea medications, we do cold caps to avoid hair loss, hydration therapy, pain medications, antibiotics. We have the experience of going through chemo is not as bad as it used to be. I mean, still, I don't wish it on anybody.
No.
But, going through newer drugs we have now with targeted therapy, anti-angiogenic therapies that are not as toxic.
Right.
It's the experience of being a cancer patient is not like when my father had his cancer 20 years ago. It clearly has changed.
And that's a really good point when you're talking about, being in pain. Doctors now will try different things. If one thing isn't working, like one pain medication, they will try different ones until you don't have to be in pain. You find a way to break through.
I don't like to put everything into a very personal situation, but when my father had his cancer, he had cancer in all over his bones. He had it in his spine and in his hip, and I did see him suffer on a daily basis. And really, the supportive care wasn't there. Yeah. Now, today, as an oncologist, I feel like more than 50% of what I do is supportive care.
Right.
Listen, if a patient has stage 4 disease, yes, you want to make him live a longer life, and they are living longer lives, but that length of time should be with good quality.
Right.
And it's not just the quantity of how long we live, it's the quality.
Absolutely.
And being able to be there and go to your kids' baseball game or be able to go to a movie with your wife and not sit home and suffer.
Right.
So, and again, there's been an explosion of new drugs in terms of pain medication. We have sprays under the tongue, we have dissolvable tablets, we have liquids, we have nerve blocks, we got radiation, we got all sorts of fancy stuff just to focus on the pain. And pain is just one aspect of oncology that requires supportive care. There's a ton of other things. It's nausea. Can you imagine every time you're trying to eat, you just can't eat. Neuropathy, dehydration, all sorts of stuff. The other aspect of symptom management is introduction of medications like Marinol, which is medicinal marijuana.
Right.
That some patients that we can prescribe through the pharmacy, and they can go get it as a pill. They can get medications. There's more research being done in terms of use of marijuana oil. Those are the areas that I think we need to focus more on in terms of how we can make the life of a cancer patient better, not worrying about addiction. I don't worry about addiction when it comes to my patients' pain anymore as cancer patients. And I don't think they'll ever become real street addicts. They might become dependent on pain meds, but they don't become full-fledged addicts because they really are suffering. They need the medication. Just like they have nausea and they need nausea medication, they have pain, they need pain medication.
Yes, after my first surgery, I found Dr. Sack. He was my surgeon, and I was in so much pain. And he's like, "Are you taking the pain medication?" I said, "Well, I'm not taking. I think it was every 4 hours, every 3 hours. I'm like, well, no. I go, I don't want to get addicted. He's like, take the pain, take it. Like, stay on top of it. Like, don't chase the pain. Like, manage it, stay on top of it. And I did it. I'm not an addict. So
no, you won't be an addict.
No.
And again, a lot of times when we have younger patients, people who are 18 or 19, and the families are worried about, oh my God, my son is taking a pain medication. What's going to be with him when he's done with his chemo? There's a lot of reassurance that as long as it's done properly, under proper supervision, those issues are no issues, and people should not suffer. It's not fun to sit there and be in pain 24/7.
No, of course not. One of your patients mentioned that something about his healthcare plan, and that if it didn't work out, that you would work it out with him. So apparently, you're making it possible for all patients to be treated.
You know,
I don't want to have your door be knocked down.
Let me tell you something. One of the things that I'm genuinely, few things that I'm proud of, is that we never say no to anybody. I never forget an illegal immigrant, 32-year-old with 3 kids who came to me with stage 4 stomach cancer. And he had gone to a county facility, and he was seen and he was placed on hospice care, was sent home within less than 2 weeks on a morphine drip. And somehow they heard of me, because I treat a lot of terminally ill, sick patients. And they called my office, we brought him in. He actually was brought in here with a stretcher. He couldn't walk. 32-year-old guy with 3 little kids. I looked at him, he had no insurance. And I told my staff, we're going to put him down, and we're going to start chemo today. He lived for almost 2 years.
Wow.
And we took him off hospice care. We were able to get him emergency medical. He was treated, he enjoyed his kids. And he went on for those 2 years. I have a young lady, which I hope one day you'll meet. She was in her mid-30s. The daughter of one of my patients with no insurance came to me with right eye blindness. And she was told she had retinal detachment. You don't get retinal detachment at age 35.
Okay.
So we got her admitted with no insurance to Cedars. We did an MRI of the brain. She had a big tumor behind the orbit, and we staged her fully, and she had a large lung cancer. This goes back 8 years ago. She had lung cancer with brain metastasis. Today she's still alive as of October 5th, 2015. She made one wish to me. She said, Dr. Nassir, at the time, said, you know what, I have a 9-year-old son and a 7-year-old son. All I want from you is to make my 9-year-old be able to take care of my younger one before I die. Well, today the 9-year-old is 17, and the other one is 8 years older, and the older one is taking care of the younger one. And what was ironic, she came to me about 3 months ago, being on 8th-line chemotherapy for lung cancer. Just like unheard of. Usually these people should be dying within 6 to 12 months. She looked at me and said, you know what, mission is accomplished. My older son is 17. They don't need me anymore. I don't want any more treatment. So it just happened, as she told me that, we just got an approval for a new drug called Opdivo, which is an immunotherapy. She had not seen. She had seen every single drug in the book. And we started on this drug about 3 months ago, and she's still kicking, and she's still alive. And the reason I'm bringing all this up, if it wasn't because of my staff or an office like this, who took the initiative to take care of an uninsured patient, this woman would not be here 8 years later, and the kids would not have their mother. So that's something, we're proud. It's becoming more and more difficult. The prices of chemotherapies are astronomical. the pressures are heavy, especially as a solo practitioner. You know, we don't have donors or big companies supporting an office like this. So we got to be really careful. But we do what we can do. And the bottom line is what goes around comes around. I work close to about 18 to 20 hours a day. I was at Sears last night this morning till about 4:30 in the morning. And that's how I'm able to manage an office that we do treat highest of the highest VIPs. At the same time, we've not given up taking care of the indigent, homeless, mentally retarded, disabled, old folks that have nobody to bring them into this office. Occasionally I'm brought into my office by my other patients. We have people in this office that nobody cooks for them. My main nurse cooks for them soups and brings them in and they take it home. I have more blessed patients who are VIPs and hear about a patient not having money to eat. They send them fresh food to their homes. This all happens in this little office.
That's the spirit of cancer right there. That's exactly what we're talking about. It's, wow, it's so beautiful. It makes me feel so emotional because I have children too. So to hear that mother say that is like, wow. And you made that happen for her. I think that any parent that gets diagnosed, that's what they want, is to be with their children. And so for you to do that, for somebody that doesn't have medical insurance, that's a lot.
And you know, we're blessed to be in a country where even if you're not insured, there are always
there's
ways
options
to get help. I mean, there's programs for young women with breast and cervical cancers that automatically can get insurance. Right now, there's no issues with pre-existing situations as long as people can afford some sort of insurance. And if they can't, you know, we can push some buttons through social workers in the city to get them some sort of coverage.
I know that you won the award, Random Acts of Kindness, or Acts of Loving Kindness Award. What can you tell us a little bit about that award?
Well, it basically was an award that was given to me because of treating people who are not fortunate like everybody else. And this sort of echoed within the community, and I was approached that, you know, I'm a candidate for that. You know, it's not, I get my award other ways. I get my award from a lady she's here 8 years out.
Right.
There is no award than her telling me, listen, my kid is now 17 years old. You saved one patient like that, that's as big as of an award as you can get. For me, that award was mostly to me, it was a gesture to other people that we should all care. As doctors, what I'm doing is not really going beyond and above. That's something that should be expected of anybody. This is what we should do, and believe it or not, treating people who are less fortunate always brings more strength to me and my staff. Mm-hmm. And at the end of the day, things work out better.
I believe in miracles, and I am quite sure that you do too. You probably have some miracle stories I would love for you to share with us.
Listen, every day in this office we see miracles. I mean, sometimes it's really mind-boggling. Things that you as a doctor don't believe happens. Like a young guy in his 40s who comes into the hospital in septic shock, blood counts down to nothing, with cord compression and paralysis, with pneumonia, intubated on a machine, diagnosed with multiple myeloma at that young age.
Oh my gosh.
And I ended up, against all odds, treating him on heavy-duty chemotherapy, on dialysis, ventilated, over 6 years ago. And this man is still alive. He's back to work. He's still getting a little treatment here and there.
Right.
And he's paying his taxes. Or there's so many stories, you cannot stop. And you know, that's why as an oncologist you have to be humble, and I really discourage doctors from telling these poor patients we got 6 months to live, a year to live. Life is not in my hands. Whatever nature or God brings people, it will bring people. My job here is not to give people what one of my patients called expiration dates. Mm-hmm. Our job is not to give expiration dates. Our job is to give hope, to do our diligence. Mm-hmm. That when that patient dies, every stone is turned and nobody has any regrets. Nobody picks having cancer, but people can pick their treatments and the type and level of care they get. And I hope no family should look back and regret how their family was not treated, that the family should have been treated better. That really hurts. That's what happened to my dad. He should have been treated better at the time.
You were meant to do this. You were meant to be not just an oncologist, but a place of comfort for so many people, because not all doctors are like that. Doctors are people, they have different personalities, but I know that compassion is a huge part of trying to get over anything, any challenge, because you're vulnerable, you're ill, you're weak, and when you have a doctor like yourself leading the way, it gives not only hope, but it's very inspiring. It's beyond inspiring to me, and I wish that everybody could have a doctor just like you.
I'm sure there are better doctors out there. I hope whoever is the doctor for any of these ill people looks at their patients as their family. Yeah. That's all you can ask for. Listen, go to somebody who really cares for you just like their own sister. Not as a business, not as a corporation, not as... think of your patient as your family. Give them the proper referrals. Cut the red tape. Send your patients to a surgeon that you would send your mother to, not just because you have a business relationship with. Or send your patient to a hospital that you really would want to go yourself. Wow. And if you do that, I think we're all going to be blessed.
Absolutely. Well, I want to thank you. You are a blessing.
Thank you for your time, for being here. And I hope the message gets out there that it's all about caring. It's all about spirit of hope. It's just keeping people dancing with their cancers and not fighting constant. Yeah. And even though my patient died, she went dancing. She didn't go fighting. Yeah. And the quality of life was fine.
It's an honor.
My pleasure. Thank you. Thank you so much for being here.
Thank you.